Hi, good evening. This is Dr. Elizabeth Rostan from Charlotte Skin and Laser, and thank you for joining me as we talk about areas of unwanted fat. And we'll share with you some of the things we do at Charlotte Skin and Laser to help you with areas of unwanted fat. Well, first of all, we should talk about what kind of fat can be targeted. It has to be pinchable fat. Yes, that fat that rolls over the top of your jeans that you can pinch or at your knees. It has to be under the skin fat. It is not for underneath the muscle fat. We can't target that. That's so-called visceral or abdominal fat. So you got to have an area of fat that's just under the skin that's pinchable. And as we go through the options tonight, we're going to talk about the benefits and advantages as well as disadvantages of each one and how we use them together. We're going to review all the different treatment options and review the devices we use. And we'll also review at the very end some of the products that we use to help enhance the results from fat removal. So let's start with non-surgical treatments and the benefits of those. Well, it should be pretty obvious. There's minimal to no downtime, a much faster recovery, low or zero risk of scarring, great for removing small areas of fat, and it's even ideal for patients that have medical conditions. Some of the disadvantages is that it is not immediate results. You have to wait for these results. They do take time, and it removes less fat. We expect 20 to 30% reduction in an area with these treatments. But sometimes to achieve that, you need multiple sessions, and these can become costly as well as time consuming because you have to come in and have these treatments done. One of the newest things in cosmetic treatments is off-the-face treatments, how non-surgical treatments can improve your body, improve your skin, tone, texture, unwanted fat, tighten skin in a variety of areas from chin all the way down to your legs. And tonight we're going to focus on how we can help get rid of those pockets of unwanted fat. Some of the treatment options, we'll start with the surgical, which is liposculpture. Liposculpture is really good for larger areas of fat that are out of balance with the rest of the body shape. You do get some instant results. It's kind of a one and done type procedure, although we may map out several different procedures like an abdomen and then come back and do the hips or the flanks. Common targeted areas include belly, chin, knees, inner and outer thighs are great to do. And we can even do arms. And the time for treatment, you can be with us in the clinic anywhere from 1 to 3 or 4 hours. So great for necks. This is just wonderful. And I think this picture shows why I so often will recommend the liposculpture for reducing unwanted fat under the chin, reshaping the jawline, particularly when there's a big grab. So when there's a big grab, this is a 45 to 60-minute procedure in office under local anesthesia and a fairly quick recovery. So great procedure underneath the chin. We do use a cannula with a vacuum that sucks out the fat. The tumescent part of tumescent liposculpture or liposuction refers to very dilute local anesthesia that fills up the area and provides for a painless treatment, as well as a very safe treatment that is almost bloodless and can be done in the office with minimal side effects and downtime. We've gone over some of the areas I didn't mention before. Bra fat, great way to do bra fat. 5 to 10 days after the procedure, you're wearing kind of a post-op garment. I encourage you to get out and walk the next day. But vigorous exercise and spin classes and yoga might be a good week or two, depending on the area that we treat. We can also combine the liposculpture with a radio frequency probe called ThermiTight, that tightens the skin. For example, on the neck, we also use a lot of it on the arms and even some mildly loose skin on the abdomen and thighs. So we'll try to show a video here of the liposuction. So we've numbed the area, and this is the cannula going in on an inner thigh. You can listen carefully. We usually have some nice music going. Your choice, funky or relaxing. And this is the best part. You can see the fat coming out the tube right there. Nice yellow, blood-free fat. It's coming right out. Instant results. So really, really fun stuff. I think I have an enthusiasm for it. And here's why. Look at these results you can get with just one treatment in 1 month on the inner and outer thighs, upper and lower abdomen reshaping, in the larger area, showing flanks and hip and some of the bra fat, and an upper and lower abdomen, as well as the hips and flank. So really a big reshaping procedure here. This would be hard for us to achieve with non-surgical means. Little smaller areas, this is just simple and easy. Businessmen that just don't have time to come in and watch TV while we do a non-invasive procedure on them, this is a quick and easy, and I don't worry about them. They can go back traveling to New York the very next day and everybody's fine. Arms can be done, a great area to combine with the thermi for tightening. So cryolipolysis, this was discovered from the popsicle paniculitis, which kids can get from sucking on a popsicle. The cold freezes, damages, and destroys fat. So Coolsculpting is the cryolipolysis that we use at Charlotte Skin and Laser to target a number of different areas. One treatment area takes from 30 to 60 minutes. And with our new device that we'll go over, the Coolsculpting Elite, you see 2 treatment heads here. We can treat 2 areas at one time. So we can get both going. You kind of sit around and watch TV or read your book. Abdomen, thighs, flanks, you can even do arms, chin, can grab some bra fat around the buttock area. Anywhere we can really grab that fat. It relies on the fat being able to be sucked up into this handpiece that we'll see in the video, and there it's frozen. But after it's frozen, what we offer that's special here is further damage of that fat with an acoustic shock wave. We call it the fat cracker, as well as manual massage. So you freeze the fat, and just like busting ice, we crack it with physical means. And we'll see, we have a little video here.
Abdomens are sized.
So we're measuring, we're pinching the fat
developed by
and measuring.
And proven safe and effective in clinical studies. Coolsculpting is the
there's a guy sitting there, and we can do the arm. That's the applicator. This is the old applicator, so it's very big. The new applicator is more efficient. It grabs more fat, so we get better fat removal in one session, and it fits better. It's just more comfortable, and it fits better. And these ladies are reading, going back to their activities very quickly. And this is a cartoon showing them freezing, but really, what's fun about this video is just watching them use the applicator. We take some before and after photos, measure it out. That's how we kind of decide what we're going to do, and then put the applicator on. And here's an example of a before and 2 months after, 2 different treatment sessions with multiple treatment heads. So this patient was probably in the clinic a good 3 hours, maybe more, because we're doing multiple areas, but it gets great results without any surgery. We also offer laser and radio frequency in the clinic. And unlike the freezing, this is the opposite. They use heat to target the fat. So our radio frequency is Vanquish. It's a selective field radio frequency, so you can treat a large field. We'll show that. And the Bliss, which is a 1064 laser. We can also use our radio frequency in a different way to tighten the skin. These treatments will typically take about an hour. This is the Vanquish. This is ideal for those that are a little bit larger, body mass index over 30, or we want some circumferential improvement. So it treats abdomen and wraps around to the flanks. And this is the treatment head. You can see how you've got the center portion, which will go over the abdomen as shown on the model, and then the sides wrap around the flanks. So it's great for debulking the abdomen and the flanks in one treatment session. It's great to pair with either the Bliss or Coolsculpting. So we use the Vanquish first to debulk. And this is the picture showing the heat. The red is, this is a heat camera, heat sensor camera, and the red is the treated area showing heating. So great for debulking. And this is pig skin. This is not human. This is pig skin. And let's see if I can move me down. And you see on the left side, big gulp of fat. And then you see here where it's been treated with the Vanquish. So we have loss of fat there and reduced volume in the untreated area. So here's an example. This is a larger abdomen. You notice in the middle, there's a scar. So she is not a candidate for Coolsculpting because of the suction. She would be a candidate for Bliss, but we would probably say, look, why don't we start by getting some circumferential reduction in the size here, and that would be Vanquish. And she lost a good 14 inches roughly. I'm sorry, not centimeters, 14 centimeters. That is different than inches, 14 centimeters. So a good bit reduction. And here you see an improvement in the hourglass. So some reduction in the abdomen, but a shaping of that waistline. And you can do that with those side panels that go down on the side. Really helpful trick in our armamentarium. And here's a side view. You see some flattening, but I think you can appreciate over her hips. It's also smaller and flatter. Great for men, because they usually kind of have a larger belly and it fits under the Vanquish. If you're really tall, you'll have to have 2 sessions because the handpiece is only this big, so 2 sessions. Venus Bliss, this is a 1064 laser that's delivered through 4 different treatment heads that can be placed on different areas, hips, abdomen, midsection. It takes 25 minutes. The benefit is, and here's a picture, if we can get those 4 treatment heads on the treatment area, you get a big treatment area in 1 session. So the cartoon below shows the little graphic of how we, the frame where we hold the treatment heads in place. The fat is heated to a point where it causes destruction, and then the fat cells are removed via your body's systems over the next several weeks. So you get a lot of bang for your buck with Bliss if we can make it work. But these treatment heads, the size doesn't change. We have to make sure they fit. And here's an example of a before and after Bliss. Kybella. A lot of press about Kybella. You've probably heard of it. It is FDA approved to treat under the chin, and it is deoxycholic acid that is injected into the fat pads. And I don't use a lot of this. I have it around. I brought it in for mainly non-FDA approved uses, like little jowls or little small areas of bra fat, particularly in the front, just small areas of fat that we want to slim or shape, and we can do these with a series of injections. Again, under the chin, often I either feel like you're not big enough under the chin for Kybella, and I don't want to put you through the redness and swelling that it takes, because every treatment you can have some swelling, or you're so big that I'm like, let's just do liposuction. But we do have this here, and I will suggest it for other special areas. And so why choose Charlotte Skin and Laser for fat removal or management of areas of fat you don't like? Well, I think you can see from the presentation, we don't just rely on one technology. We evaluate each person and each area to try to find the best plan for you, highly individualized plan. And you can see, I've already talked about how we combine different things and try to get the best results for you with the least visits and the least amount of money. We also offer a variety of skin tightening devices and enhancements that can help the skin over these areas. And ladies these days are wanting to continue to look nice in skirts and pants and bathing suits. And these additional areas can be improved with skin enhancements as well as tightening treatments. They're actually very popular. So how do we decide who gets what? When you come in, how is it that we come up with your treatment plan? Well, just to share with you some of the things that we think about. If it's a larger area or multiple areas, we may consider liposculpture. You get a lot more out of just one treatment. Or we may do a little combination of that Vanquish and either Coolsculpting and Bliss. Can we get 4 of those Bliss applicators on an abdomen? That's really good for men, because they're a little bit larger than women, and we can get 4 of them on there, and you just get a lot more done with one treatment. And cost can be a factor, and believe it or not, the surgical liposculpture can be less expensive than the non-invasive. Is the area very mobile and flexible, or is it immobile and hard to grab? We do rely on mobility to get the Coolsculpting applicator in place and allow it to really suck up that fat into the applicator head where it's treated. So if it's not very movable, we may consider Bliss or Vanquish or even liposuction. If it's a very small area, then we might go to that Kybella that I was just telling you about, or I might just say, hey, let's go liposuction your knees. It's such a small area, very easy. Other things we think about, pain tolerance. Coolsculpting can be a little painful with the freezing process. Vanquish and Bliss are completely pain-free. And if you're worried about pain, some might even choose liposculpture, oddly, because we can give you medicines to help you relax, and it's just one treatment and you're done versus multiple treatments. Time is a big factor. If it's difficult to find time in your schedule, then we may rely on the one treatment option. Multiple treatments are required of the non-invasive. However, if you're on certain medications or have medical conditions, we may choose a non-surgical option for that reason. And then lastly, we're going to talk about how we have some products that can enhance the skin and enhance your results. The Charlotte Skin and Laser Retinol Repair Body Lotion is a great body cream. It contains retinol, which is rejuvenating and exfoliating, and hyaluronic acid, which is hydrating and helps plump the skin and make it look smooth. So this is good for areas of sun damage or photo aging and for dry skin. The Elastin Transform Body, this has got a peptide that helps clear out the fat, the lipodrome. So when the fat is treated with a non-invasive method, it needs to be cleared out of that area. And we can try some physical means like our fat cracker and massage, or our electromagnetic massage therapy. But we send you home with this body lotion that helps clear out the fat. This also has the patented Trihex technology, which renews skin. So better looking skin and better fat removal. And then the Revision Body Form lotion, this actually tightens the skin with a peptide, and it actually works. It's a nice thing to do on arms that are flappy or even legs. It's a great cream. It smells nice too. So thank you for your attention. We will take some time to answer some questions here at the end, and we encourage you to make a consultation. Let's see. We're getting a few questions. One question is, what about these treatments, and how do they have a role with gastric bypass surgery? That's a very good question, and we do have some patients that have had gastric bypass surgery that are candidates for liposculpture for fat removal or the non-invasive. One of the issues often is how much fat was lost during the weight losing process associated with the surgery. If it was a lot, then the extra skin might be too much of an issue. And that is not addressed with the non-invasive. And it's addressed a little bit with the liposuction. So with the liposuction, you don't just have flappy skin, but it does not remove excess skin. So that would have to be evaluated on an individual basis. And maybe some areas could be addressed, but some areas like the abdomen might need a surgical intervention. So it's a little bit of both. We do handle some, but some we have to send out to the surgeons. And there's another question. We've talked a little bit about bra fat. Well, what the bra fat is the fat that kind of rolls over on the chest wall. You can roll it and pinch it typically. So it's a good candidate for Coolsculpting or liposuction. If it's real small, then I would do Kybella. We pinch it and do the injection. But liposuction and Coolsculpting. The bliss is difficult unless you're really big in the bra fat area. And Vanquish is difficult too. Vanquish is really better for thighs and abdomen. It doesn't wrap around the bra fat. But very treatable, very doable, and actually very easy with high satisfaction and great reward for the patients, both on the back as well as the front that pops out here. Oh, and we're getting a question about one of my other favorite areas. And thank you for asking. Knees. Oh, knees are just wonderful to treat because it's such a nice pinch and the skin is tight and it rebounds quickly. I'm talking about the inside of your knee that you can reshape. Very easy with liposuction, but we can also use our Coolsculpting applicators in that area. Now, for the crepey skin on top of the knees, we can do a variety of energy treatments to tighten the skin after we've reshaped and use some of the creams as well. So really what we're doing with off-face rejuvenation is transforming women that quit wearing skirts, for example, or shorts because they hate their knees or the backs of their thighs. Same thing on the crepey skin on the upper arm. We can do filler as a biostimulatory agent and some of our tightening devices. But if you've got a grab of fat on your knee, you would love it. There's just no way around it. You would love it, and it's easy. We would be best friends for life. I'm trying to see if there's any other questions. So question about the skin when we do chin. It's amazing the amount of tissue retraction and tightening you get when we do a chin liposuction. And we do these a lot on young people that they just bounce back and get a new jawline. It looks great. If you're older and we choose to do a little liposuction here, we will often combine it with that radio frequency probe I was telling you about called ThermiTight. It's a great thing to combine it with to tighten the skin. And you do get some nice skin. So the probe is literally, it's smaller than this, and it goes under the skin and delivers radio frequency energy for tightening. And this can be done also on the arms and the knees and sometimes the abdomen. So if there's a lot of skin, I will encourage you to go get facial plastic surgery, get the skin cut out, a neck lift. But if there's just moderate laxity, and fullness. We can totally take care of that here in the office with our tightening devices and or the liposuction fat removal or Coolsculpting. So it's really a great area, and you don't have to live with your double chin. There's a lot of options. So I think that's about all the questions we'll answer. I encourage you to email any questions that you have or give us a call. Or just come in and make an appointment. We can pinch and grab and draw and plan and come up with a solution for whatever's bothering you in the mirror. Thank you for joining us this evening. Everybody have a great evening. And I'll sign off now. Good night.